Hi everyone, my name is Kenisha Brown. This is my educational project on catheter-associated urinary tract infection, otherwise called Cauti. Objectives. Nurses will be able to identify risk factors of Cauti. Nurses will understand their role in the prevention of Cauti. Nurses would be able to list the appropriate indication for urinary catheter insertion and continued use. What is Cauti? One of the most common hospital infections a person can contract during stay. Indwelling catheter are the causes of 75% of urinary tract infection. Indwelling catheter is a tube inserted into your urethra to drain urine from your bladder into a collection bag. Causes of Cauti: endogenous, middle rectum vaginal colonization; exogenous, contaminated and manipulation of collecting system. Usually the females are affected by the extraluminal and the males are affected by the intraluminal. Other sites of contaminations, as you could see, the arrow pointed to all the sites: urinary bladder, catheter urethra interface, catheter and drainage tube junction, drainage tube and collection bag junction, and the drainage port. Causes of Cauti. Cauti is caused from bacteria or fungi enter your urinary tract through the catheter. Other causes are: catheter may not clean regularly, drainage bag may not be emptied often enough, catheter may become contaminated upon insertion, contamination of drainage pot when emptying urine from collection bag, contamination of the junction between catheter and drainage tube. Urine in the catheter bag may flow backward into the bladder. Acceptable and unacceptable reason for placement. Some acceptable reasons are acute urinary retention, acute bladder outlet obstruction, accurate measurement of urinary output in critically ill patients, healing of open sacral or perineal wounds in incontinent patients, to improve comfort for end of life if needed. Patient requires strict prolonged immobilization. Unacceptable reason for placement: incontinency, morbid obesity, confusion or dementia, patient request, immobility, urine output monitoring outside of intensive care. Risk factors: minimize use of indwelling catheter in all patients, especially those at higher risk of Cauti and mortality. Examples: elderly age, women, diabetes mellitus, impaired immunity, renal dysfunction, prolonged catheterization, improperly trained personnel. Signs and symptoms of Cauti. Cauti causes pain, death, length of stay, and healthcare costs. Some signs of Cauti are chills, fever, dysuria, vomiting, hematuria, cloudy urine, strong urine odor, unexplained fatigue, pressure, pain, or discomfort in your lower back or stomach. How to treat Cauti. Cauti usually treated with antibiotics. A urine culture done, then bacteria is being treated based on culture's results. Some examples of antibiotics are macrobid, rocephin, Keflex, Bactrim. Other treatments include discontinue Foley catheter, drink fluids. Impact of Cauti. Cauti is a preventable infection and can be deadly. Cauti represents 13% of hospital-acquired infection. Cauti is associated with an excess length of stay of 2 to 4 days. Cost per patient associated with Cauti is approximately $1,000. Cauti make up 2% of excess costs in U.S. hospital associated with all hospital-acquired infection. Cauti are associated with an increased cost of $400 million to $500 million annually. Cautis are no longer reimbursed by CMS as of 2015. Excess costs associated with hospital-acquired infection are no longer covered by Medicare or Medicaid. Cauti rates are examined as part of CMS Hospital-Acquired Condition Reduction Program. If a hospital has a high rate of Cauti, as well as other hospital-acquired infection, it can face a 1% reduction in Medicare payments as part of the program. CDC estimate that 17% to 69% of Cauti can be stemmed with recommended infection control measures. How to prevent Cauti. Clean around the catheter each day. Keep the catheter tube from kinking. Keep the drainage bag below your bladder. Change the catheter at least once per month. Empty the drainage bag several times per day. Wash your hands before and after touching the catheter or drainage bag. Insert catheter only for appropriate indication. Leave catheter in place only if needed. Ensure that only properly trained persons insert and maintain catheters. Insert catheter using aseptic techniques and sterile equipment. Following aseptic insertion, maintain a closed drainage system. Recommendation strategies. Implement recommendation for use, insert and maintenance. Ensure compliance with recommendation. Use alternative to indwelling catheterization. Portable ultrasound device to do bladder scan. Antimicrobial or antiseptic impregnated catheter. You can also implement quality improvement programs like alerts or reminders, stop orders, protocol for nurses, directed removal of unnecessary catheters, guidelines for appropriate perioperative catheter management. Pre-test and post-test questions. Pre-test, what is Cauti? How do you prevent Cauti? What are the risk factors of Cauti? Post-test, do you feel the information was relevant? Are you comfortable identify risk factor of Cauti? How has this training and information changed your perception of Cauti? This is my reference. The end. Thank you.